Hello everybody. So it's our next live Q&A from Avon Valley Practice this evening, and thank you so much for joining us. Now, after I've done our kind of introductions, you all know that you're going to meet Joe, our physio. He joined us in October. He's what's called a first contact physio, and many of us think, what on earth is that? What does that actually mean? So Joe's going to kind of go through all of that with us and explain what he does, and actually he's one of two, because we also have a lady called Emily in our group, but she's based predominantly at Sarum Health Group, as opposed to Joe, who's primarily based at Avon Valley Practice. But before we go any further with Joe, I'd just like to give a couple of updates about Avon Valley Practice. Number one, Dr. Esme Dobson is starting with us on the 1st of April. She may be remembered by some of you, particularly when you meet her. She did her training with us a few years ago before COVID, dare I say it. So she'll be here with us on Tuesdays and Thursdays, joining Dr. Green, Dr. Miller-Craig, Dr. Combat and Dr. Hutchinson. And of course, we also have our doctors who are in training to become GPs as well. So we will have 7 GPs working from Avon Valley Practice from the 1st of April. We also have our COVID-19 vaccination clinic starting again for all those people over the age of 75 or birthdays turning 75 before the 30th of June 2024. So those invites will be coming out soon, along with those people who've got immunosuppression. There are only a handful of people in our practice that are immunosuppressed, but they will be invited for the vaccination as well, and we'll be looking to do that on the 26th and 27th of April. But we're going to run a whole other live Q&A on the 8th of April, all about COVID-19. So please touch base with us about that and spread the word that it's coming, and find out what the vaccine is, what we'll be doing, and how we'll be doing it this time. And lastly, you may have heard in the press about online consultations, digital progress within general practice. Indeed, we are launching a system called SystmConnect next month to help make our services more accessible to those people who are able to use internet services either off a smartphone or a computer, stroke laptop, stroke iPad, etc, etc. So if we've got time later on, we'll be talking about that as well. However, again, on the 8th of April, that will be our other topic of conversation. So yes, come back 8th of April for our discussions about COVID-19 and SystmConnect. So without further ado, let me move you over to Joe. He's going to explain all about physio at Avon Valley Practice. Welcome, Joe.
Hello everyone, nice to be here. As you said, my name's Joe. First of all, thanks Anna for introducing me. So my name's Joe. I'm one of the physiotherapists here at the practice. I'm what we call a first contact physiotherapist. So the idea is that we're advanced kind of musculoskeletal practitioners, working obviously mostly based with sort of musculoskeletal care. Just a little bit about myself. I've been qualified a number of years now. I did 18 months working in hospital rotations, working in medical, surgical, orthopedic, intensive care, everything that there is to do in a hospital. I did 12 months in outpatient physiotherapy, and then I've done sort of 10 plus years working in professional sport before I've come back to primary care. Just a little bit about kind of the service initially, just to sort of describe kind of what the aim of what we're doing here is. The aim is to sort of diagnose and to give kind of early advice, really to allow sort of any patients to self-manage, and if they're unable to self-manage, to then refer on to sort of destinations. It's not really designed as a substitute for sort of outpatient physiotherapy. The role of an FCP is there, as I say, is not to bring sort of regular manual therapy or regular sort of treatment sessions to get people back in weekly, but to provide that initial early access to support and then refer on to any sort of ongoing support as needed. Next slide. In terms of kind of things that we would generally look to see, as I said, I'm a musculoskeletal specialist. So musculoskeletal basically means anything, any pain that is affecting the muscles, the ligaments, the tendons, the bones, and the sort of joints of the body. So that can be a range of things. So it ranges from sort of acute injuries, so sort of sprains and strains, anything like that, to kind of more degenerative arthritic conditions, obviously affecting kind of all joints of the body specifically. Common things that we tend to see generally a lot here would be things like plantar fasciitis, knee pain, arthritic knees and knee injuries, arthritic hips and hip pain, lower back pain, shoulder pain, neck pain, any sort of major joint pain. And as I say, we specialise generally in anything related from acute to sort of degenerative sort of changes. Next slide. We also offer kind of post-surgical care and orthopaedic guidance. The sort of aim really there is to give you some ongoing management and guidance. Most people that's had sort of surgery will get some form of ongoing support in terms of sort of post-op exercises or advice, but those that don't, or those that need sort of further support from that, obviously we offer that as an option. I've worked in orthopedics myself and professional sport, so I've seen a kind of fair share of surgeries over the years. So I've generally got a sort of pretty good understanding of post-management and those sort of things. Next slide. There are a few kind of limitations on people that we sort of do and don't see here in the surgery. So obviously you can read those ones that are up there. Generally, people have to be 16 years or older to see myself, and if not, then they'll be referred on to see the GPs or the advanced nurse practitioners. Those that sort of acutely unwell, we tend not to want to see, even if it is for sort of MSK conditions. If you're acutely unwell and that's sort of the main ongoing issue at that time, then we prefer that you to see the GP or the walk-in clinic or 111 or obviously in emergency situations A&E. We're not generally here to design for sort of medication reviews. So although we do kind of offer support and analgesia for any pain relief and can recommend certain analgesic medications, we're not here to prescribe medication or kind of review any sort of current medication for other sort of medical pathologies that you have. We don't specifically treat headaches. And I know that headaches can come from disorders of the neck, but it's not specifically the first port of call. Really, the first port of call for that should be GPs or your advanced nurse practitioners. And if they kind of review you and say that they don't think there's any other pathologies and they think it's related to the neck, then we can see you ourselves. It shouldn't really be your first port of call at all. Other neurological respiratory conditions, generally, again, we're not tend to sort of see. We can offer advice on anything like that, but not as a sort of first port of call, and generally referred on from the GP if needed. And then lastly, kind of women's health, antenatal, postnatal problems, pelvic girdle pain, SPD, those sort of things. Again, they're a bit more specialised. So support would be offered through your GPs, the advanced nurse practitioners, and then any ongoing support would be done through sort of specialist referral to sort of, say, other physiotherapy services. Next slide. So how to sort of get to see me or book an appointment specifically. So the first thing really would be obviously phoning up through reception or through the new service coming, SystmConnect. Appointments can be both kind of in person or over the phone. And for those people that aren't quite sure whether they perhaps need to see a first contact physio or a doctor, again, we can offer some telephone appointments to discuss that and offer appropriate advice. Generally, for kind of the conditions that we've discussed above, kind of musculoskeletal conditions, so any acute injuries, pain related to the ligaments, tendons, bones, or arthritic conditions, then I should be the first port of call, really. So first contact physiotherapist should be the first port of call. And if we're unable to sort of offer the support that we need, we can obviously refer you on to anywhere else it needs to be, or the GPs. I say we tend to kind of work quite closely alongside the GPs, but for any kind of more sort of severe pain or emergency conditions, we can offer kind of same-day services. They're kind of limited appointments, generally with the GPs would be as well, but there is a few sort of same-day services for more sort of severe and acute things. And otherwise, generally, the wait time for myself is significantly less than that of a GP. So getting to see me should be an awful lot quicker than seeing the doctors themselves.
Joe, sorry to interrupt you. We've just got feedback that you keep breaking up. I don't know whether you need to just move your headset a little bit from your microphone.
Any better?
It's hard to tell from our end, but let's see how you get on.
I'll hold it there
feedback.
anyway.
Yeah, great. Thank you.
Yeah. So next slide. So what kind of sets us apart as first contact practitioners compared to kind of the normal physiotherapists? As I said, we're considered kind of specialists in musculoskeletal conditions, but not just specialists in sort of diagnosing and assessing the musculoskeletal conditions, but also in kind of assessing any like musculoskeletal conditions alongside it. So medical causes of pain. So things like inflammatory arthritises, infections, possible malignancies. So there's an all sort of range of sort of questions and assessments that we would do alongside that to potentially kind of assess for and diagnose any kind of MSK conditions. So for people that are concerned, thinking, well, I don't know whether this is a joint pain problem or a muscle problem, or whether there's something something else alongside that in terms of medical conditions, again, we're trained to spot the sort of specific signs and symptoms of those things, and if it needs managing, then as we said before, we work really kind of closely with the GP, so we can refer you on, we can chat through any sort of conditions that you're having, any signs and symptoms, and get advice from the doctors as well, sort of fairly quickly. Also alongside that, we have the same kind of referral rights as a GP, so we can request x-rays, we can request ultrasounds, we can organise additional investigations, so blood tests, nerve conduction studies, anything like that. In terms of medications, although I said we don't offer specific prescribing details of medications themselves, we can offer advice on analgesia, and we can request prescriptions from the doctors themselves, which are often with a little bit of advice from them, but generally sort of taken through from our point of view. And I know we said earlier, generally the aim of the service really is to give sort of quick access and early access to sort of specialist advice for sort of any patients with sort of MSK conditions, and to kind of reduce the workload for doctors. And ultimately, by doing this, we help to kind of reduce the waiting times for GPs as well. Thank you very much. Over to Anna.
Hi, thank you so much, Joe. Much appreciated and very informative. So in terms of questions, everyone, to the floor, there are no questions so far. So can I ask, does anybody have any questions for Joe? It could be anything and everything, preferably physio related at any sort, to be able to do that. But we have had some good feedback, haven't we, Joe, from patients who have seen you, whereby they've come into the walk-in clinic and actually written on the form, a symptom that is related to what Joe can offer, and actually kind of books an appointment for that afternoon or the next day to be able to see that patient without having to wait in the walk-in and find that actually that was what was going to happen anyway. So that's kind of a good tip, isn't it, really, is to contact us, or indeed do turn up to the walk-in, but be prepared that actually if the reception team suggests that the physio, that is Joe, who you've met now, that he can deliver a care and service for you that would be much quicker than waiting. A bit like our mole clinic, which is what we talked about last time. It's much better to see the right person first time than see a number of people over a prolonged period of time to obtain the treatment that you needed from the first place. Now, Sam has put a question in, and he says, he or she, in terms of that, says, Joe keeps mentioning MSK. What is that?
Possibly that might be when we
Joe,
we broke
just
up.
wait 1 second, Joe. Just, yeah, here we are.
Sorry, possibly that might have been kind of when we broke up a little bit. MSK means musculoskeletal. It basically means that any pain relating to sort of the bones, the muscles, the joints, the ligaments, tendons, or anything like that of the body. So kind of non-medical causes of pain, really. So injury or degenerative sort of changes.
Fab. And as I talked about the walk-in clinic, to be able to do that, you don't need to pass over. Helen's getting all worried as the producer, thinking that I need to be live. I don't need to be live to be able to do that. If you can pass back to Joe, Helen, that would be awesome, because I'm just going to ask Joe another question. So let's just wait for that to catch up and be on Joe. So Joe is now in your screen, and I'm going to ask him another question, and that is about the walk-in clinic. And what are the kind of things that people have kind of rocked up to the walk-in for, to then find that actually it'd be much better to see you? Have you got any examples of that?
Yeah, so anyone with any acute injuries or sort of sudden onset of sort of severe pain, so even more kind of the degenerative conditions that have really acute inflammatory onsets that we'd be happy to see. But mostly it's for your acute injuries or undiagnosed kind of neck pain, back pain, shoulder pain, those sort of things. Those are the conditions that we generally tend to be more helpful for, and obviously generally said the wait time is significantly less to see us.
So that's a great tip, isn't it, in terms of that? And again, somebody else who's anonymous has asked, is it only up Avon or can we make appointments in Durrington? So can you explain your working week, Joe, in terms of where you
Yes.
are?
Yeah, so no, it's both places. So I work basically every morning, so morning clinic every morning in Durrington, and then 2 afternoons a week in Upavon. Generally, appointments are sort of say easier to come by, probably a little bit in Durrington because of the spread, but there is available appointments in Upavon sort of twice, 2 afternoons a week. And as I said, there are always reserved spots for kind of emergency things. There was a couple every day for any sort of severe onsets of pain or injury.
Thank you, Joe. And I think that's really important, everybody, when we were talking about SystmConnect, because what we're going to be looking at is how you can contact Joe without having to come to the walk-in or without having to phone up. Now, those options are always going to be available, but we will be setting it up for online shortly. However, before we do that, Joe, is there any kind of self-care tips that you always suggest to people when they've had some kind of, well, let's call it musculoskeletal, MSK, kind of flare up or injury or pain in some way? What's some self-care top tips for people?
Yeah, so in terms of kind of managing more acute injuries, then generally we tend to advise the normal prescriptive things that people would hear about. So your resting of any sort of acute injuries, your compression of any injuries that are needed, ice for any sort of acute swelling and pain relief, and then elevation for sort of your standard injuries. For most degenerative or arthritic conditions, lots of the advice and the self-managing comes from exercise therapy and movement. And sometimes that can sound a bit counterintuitive for someone that's in pain. But the benefits of that and then the real sort of causes and reasons why we do exercise therapy is a fewfold. So for anyone that has any degenerative joint changes or pain, quite often a lot of the pain comes from the stiffness that's related to that and the lack of mobility and the lack of strength we get from not moving, sorry, due to the pain. So then when we encourage little bits of gentle movement, firstly, what we do is we increase muscle activity. So we can't change the joint structure underneath, but we can massively improve the framework around the joint. So the stronger the muscle tissue is and the more active it is, the less pressure goes through the joint on every single movement, every step, every single time you bend or straighten a joint. So there's a lot less pain from that point of view. Also, what we do when we move a joint is we create something called synovial fluid. So synovial fluid is a lubricating fluid for the joint. It's basically just like the body's own version of WD-40, but it naturally is produced with kind of movement. So the more you move, the more you get production of it. The less you move, the less you get production of it. So the more we can move, the less stiffness that we tend to get in joints and the less irritation we tend to get in joints. And then probably the biggest thing for anyone who has kind of any pain symptoms for a longer period of time. So anyone that has pain for over anything above sort of 6 weeks or longer than that, is that we get a lot of sensitivity changes to the nerves. So pain can become a little bit odd and say can be triggered by not necessarily normal pain reactions. So nerves are responsible for quite a few things in the body. So nerves are responsible for pain, as we said. They're responsible for movement. They're responsible for sort of temperature, sensation, and for that position sense of the body. So if I was to close my eyes and put my arm out to the side, I know it's there. I don't have to have my eyes to see it. We just know it's hanging there. But what can happen is that when you fire that nerve pathway regularly, so you get someone who's got pain sort of longer term, that those pathways become really, really sensitive. So what happens is that the best way probably to describe it is someone can have the most arthritic knee joint in the world, but sometimes really small amounts of movement in that middle range actually don't stress the joint whatsoever. But some people still get quite significant pain from that. And basically what is happening is the body is telling you, I am moving, therefore I must be in pain. It just associates everything as pain because it's so sensitive. So what movement does is it desensitizes that, and it basically reteaches the body that actually movement and pain are two separate entities. So that's kind of the main reasons that's the sort of benefits of exercise therapy for kind of degenerative and chronic pain conditions.
And is that summarized in what we sometimes hear as RICE? Rest,
Yes.
ice, compression, elevation. Is that what we do when we've hurt something like lower limb and can? But you're talking about movement as well on top of that?
Yeah, so RICE generally tends to come in the form of acute injury. So something that's sort of acutely painful. So someone has pain sort of straight away. So as we say, we reduce the sort of amount of loading that we're doing. We want to elevate it, we want to compress it, and sometimes we use ice to sort of help with any inflammatory effects and any swelling. The movement therapy tends to come with the more degenerative and chronic sort of conditions. Although generally anyone that tends to have sort of pain, apart from those sort of first 48 hours where we have a major sort of inflammatory response with acute injury, as long as we are gently moving, and after that, we don't tend to cause any more further structural problems. And then actually a lot of the pain and problems that we get from an acute injury are the fact that we don't move. So we don't move. It doesn't take very long to not move. So sort of not moving a joint normally for 2 days, 3 days is often enough to really reduce the muscle activity, to increase the sort of joint stiffness. So a lot of the ongoing pain and symptoms that you get, specifically, let's say something like an ankle ligament injury, it's not necessarily related to the ligament itself being painful every time you take a step. It's related to the stiffness, some of the swelling, and some of the irritation you've got from the fact it's been painful and you haven't moved for a few days. So that's why we really encourage those early bits of sort of movement in the acute things as well as the sort of chronic things. Also, in terms of tissue healing, most structures do need some stress for them to heal appropriately. If you injured soft tissue or bone tissue or anything like that, if you did no movement whatsoever, the tissue would likely heal, but it would heal very immature and very weak, and it actually wouldn't really be fit for purpose. So you do need that initial bit of sort of movement therapy, loading base, to encourage it to heal in an appropriate manner, and so the structure of the tissue can be nice and strong and closer to what it was kind of pre-injury.
Right, and that's the importance of coming to see you rather than coming to see somebody that can't necessarily advise you on that movement. So that's the important thing of seeing you in the first phase and contact of that, rather than waiting to see a GP or come along and saying the walking and having a slightly longer wait than actually coming to see you first.
Yeah, definitely. I think GPs are absolutely brilliant, but in terms of kind of musculoskeletal therapy and musculoskeletal care, I would say that generally we are the experts. So hopefully you should be using our services and hopefully promoting that.
Absolutely. Our doctors are generalists. That is their name, general practitioners. They are the gatekeepers that move you to other people and can see that, and you are the expert when it comes to, like you say, musculoskeletal things like that. So going forward to kind of be able to book appointments with Joe, if we just move back to me, we'll just finish it off with some ways of being able to do that, and then we haven't had any more questions for a while, so please, if you've got any questions, make sure you ask them in the next couple of minutes, so that while Joe's with us before he is going off just to finish off his clinic in a little bit. So booking appointments with Joe, we know that our demand and capacity for the telephone service is difficult. We know lots of people want to phone up at 8 o'clock and get an appointment to be able to do that. Like we've said, within the month we will have an online option to do it. And remember, at the moment you can contact us through our website to say that you need to see Joe, and our team will book an appointment accordingly for you, or on the phone, or come into the surgery and come to the walk-in, or indeed just come to reception and we'll be able to help you. So it's a pop-in, it's a telephone, it's online that you can contact Joe to make that appointment timely for you to be able to receive that first contact physio rather than have any other delay. His availability, it's Monday to Friday in Durrington and Monday and Tuesday afternoons in Uphaven, but he does go on holiday, and there is only one of him. So unfortunately, if you do get injured on the first day of his holiday, there will be a delay to but you know, it's one of those things. That's how it all works, doesn't it? And the GPs are still available to you when Joe isn't, same as our same day team of nurse practitioners, and we still have our abilities to refer you to other physio services as well. Joe won't be providing you ongoing physio. He sets you up and then makes sure that you've got everything there and ready, and then can move you into long-term physio if that's the right thing to do with the physio services that are available in the community, or indeed to other clinicians if perhaps your condition takes a different journey to what was anticipated from the outset. So we still don't have any questions. So on that note, I think it's probably time to turn off and say thank you very much, Joe. And please do come back on the 8th. The invites will be coming out soon. It's all about COVID. It's all about SystmConnect. I think you'll love it. I promise. It's good. It's exciting. So we'll see you again soon. Thank you very much.